25 gauge needle, 5/8 of an inch.
Hi, Anita.
I have my alcohol
I'm going to be
swabs.
giving an IM shot,
And then
mosquito shot to an adult today.
check.
So we have the orders, we have
I'm
everything set. So
medicine,
first I'm
part.
going to perform hand
I'm going to
hygiene.
be looking for the
Then
penicillin.
I would have arranged all my
I'm
correct
gonna
supplies,
unlock
which
it
I've already done ahead of
doing my
time.
first check. It is
And
penicillin.
in doing so, I unlock
And
the
then
medicine
going to do my
drawer
second check.
or the automated system or whatever it is, and I
patient,
compare one med at a time for
it is the
one
right dose.
patient at a time.
It is the right time.
And I selected the
It is
correct
the right
med from the
group.
drawer, which is what we have here.
And it is the right.
And it would be penicillin, 2.4 million units. So we have that, so that would complete our first check. So I grabbed that from the drawer, and next I would be comparing the drug label with the actual MAR, which would be my second check. So, and during that time I would also state the rights of the patient, which would be right patient, right med, right dose, right route, right time, right reason, and right response.
Remember that we're using IV, so you don't have to start from the beginning.
And arranging all my supplies,
It'll be home on.
I also had to calculate the correct dose. So it would be, the order was to be giving 2.4 million units of penicillin, which the calculation turns out to be 1.2 mLs.
I'm going to be giving an IM injection.
So I've checked the expiration dates, and they're within range. It's a brand new bottle. So, and if it was a immunization shot, I would document the lot number, the expiration date, and the manufacturing company, just so everything is specific, so you know what you actually gave. Next, I would determine the correct syringe and needle size for an IM injection for an adult. And if I grabbed it from the fridge, I would want to warm it up with my hands. Don't shake it, just keep it in your hands and warm it up. So for an adult, I would be approximately like a 1.5 inch needle length with a 21 to 25 gauge.
I'm then going to draw up my medication.
And before returning the med back to the drawer or the refrigerator, I perform my third check of the patient's reg, which would be right patient, med, dose, route, time, reason, and response. And as I already did, I grabbed everything, I returned everything in the right spot, and I would have locked the cart. So
I'm going to make sure I do the right calculations.
I would approach
so here there's 2.4 million
and I do a
units.
double identifier.
There's 2 million units of penicillin, so I'm going to be drawing up 1.2 milliliters.
With their tag, their patient number with the MAR. And I could also go, if he was verbal, I could ask him his name, date of birth, and such. So now I would be selecting the appropriate injection site, which for today, for an adult, would be the ventroclavial site. So you'd take that if you could roll on the side, you would find the iliac crest and the greater trochanter with your thumb and your index finger, and you would just sort of shoot it right in the middle of the two.
You can pause it because I forgot to aspirate first.
Now I would apply clean gloves.
Right. Yep. So I'm then going to just clean off top of my medication.
And I would also verbalize the landmarks and making sure to avoid any compromised areas, open areas, wounds, bruises, stuff like that.
Aspirate.
So now just draw up my med.
mLs.
So if I'm giving 1.2 mLs, I'm going to use
And then I'm going to draw out
3 ml syringe. So that's a brand new bottle. Don't really have to wipe it down with alcohol, but I pretend that I did. So I'll rip it open, circular motion, allow it to dry. So it's going to be 1.2 mLs.
And then just change.
I would pull it down to 1.2.
For sterile reasons.
Inject the air. And withdraw 1.2. Making sure there's no air bubbles. And flicking out their air bubbles.
Put the cap back on it.
So.
You twist it off just like you twisted it back on.
So now we would change out the syringe just because there's any solution left in the original needle. Going to cause the needle to dull while withdrawing the growth, the solution might be irritating to the skin since we're going into the muscle.
Okay, and I have all my supplies together to go into the patient's room. I am then going to do my third check before we're putting the
Grab
medication
a new
away.
needle.
It is the right patient.
It's gonna be 1.5
It is the right
inch.
medication. It is the right dose.
Pop off the
and
old
50
one.
milliliters, it's the right time. The medication is not expired. It is the right manufacturer, and it is the right
Pop on the
lot number.